134th day of Swasthya 365 project. I'm going to talk about Alzheimer disease. What is Alzheimer disease? According to the National Institute of Neurological Disorders and Stroke, Alzheimer disease is a progressive neurodegenerative disease that occurs when nerve cells in the brain dies. The disease often results in the following behavior: impaired memory, thinking and behavior, confusion, restlessness, personality or behavior changes, impaired judgment, impaired communication, inability to follow directions, language deterioration, impaired thought process that involve visual awareness, emotional apathy. With Alzheimer disease, motor function is often preserved. When Alzheimer was first identified by German doctor Aloysius Alzheimer in 1906, it was considered a rare disorder. Today, Alzheimer disease is recognized as the most common disease of dementia, a disorder in which mental functions deteriorate and break down. According to the Alzheimer's Association, this number includes 5.1 million people over the age of 65, as well as 2 lakh to 5 lakh people younger than the 65 who have early onset of Alzheimer's and type of dementia. How Alzheimer disease is different from the form of dementia. Alzheimer disease is distinguished from other forms of dementia by characteristic change in the brain that are visible only upon microscopic examination during autopsy. Brain affected by Alzheimer's disease often show presence of following: fiber tangles with a nerve cell, clusters of degenerating nerve endings. Another characteristic of Alzheimer disease is the reduced production of certain brain chemical necessary for communication between nerve cells, especially acetylcholine, as well as norepinephrine, serotonin and somatostatin. Now let's move on to the risk factors. Age. A main risk factor for Alzheimer disease is increased age. Genetics. There are also a genetic risk for the Alzheimer disease. Less than the 10% of people develop in the disease in 4th through 5th decade of life, that is 40s or 50s of their life. At least the half of the early onset patients have inherited the gene mutations associated with the Alzheimer disease. Common form of the certain gene increase the risk of developing Alzheimer disease but do not invariably cause Alzheimer disease. The best studied risk gene is one of the encodes apolipoprotein E, estrogen. Many studies that found the women have higher risk for Alzheimer disease than the men. The apparently increased frequency of Alzheimer disease in the women led to the considerable research about the role of estrogen in the Alzheimer disease. Other risk factors for the Alzheimer disease are high blood pressure, heart disease, diabetes, possibly elevated blood cholesterol level. A majority of people with the Down syndrome will develop the brain changes of Alzheimer disease by 40 years of the age. People who suffered significantly with the head injuries early in the life, particularly among those with the ApoE4 gene. So what causes the Alzheimer disease? Although the intense investigation have been underway for many years, the causes of Alzheimer disease are not entirely known. The National Institute on Aging says that suspected causes often include the following: age and family history, certain genes, abnormal protein deposits in the brain, other risk and environmental factors, and immune system problems. What are the warning signs or the symptoms of the Alzheimer disease? According to the Alzheimer's Association, the following are most common symptoms of the Alzheimer disease. However, each individual may experience some symptoms differently. Symptoms may include memory loss that affect the job skills, especially a short-term memory loss, difficulty in performing the familiar task, a problem with the language, deterioration to the time and the place, for example, forgetting where they are, losing the track of seasons, dates and passage of time, poor or decreased judgment, for example, poor hygiene or poor judgment when dealing with the money or financial matters, problems with the abstract thinking and misplacing things, and change in the mood or behavior, changes in the personality, loss of initiative or withdrawal from the social or work activities, misplacing things, loss of ability to recognize who people are, even people well known to the individual such as his child or spouse, when the disease is progressively to the severe stage. The symptoms of the Alzheimer disease may resemble other medical conditions or problem. Always consult your doctor for diagnosis. So thank you and stay tuned for stages, precautions and treatment.